So pranayam is the concept. The prana refers to the breath. Okay. And in siddha system of the medicine, breathing is considered to be most important of all functions, providing the vitality and the freedom from diseases. Okay. So not only in the siddha system, ayurvedic system is also considering it is the most important of all function, because it is a pran, it is considered as a pran, or we can say life of an individual. So if breath stops, the human is not living, he is considered as a death. So that is why breath is important. Siddha system medicine is considering the most important of all, and control breathing is the method of charging oneself with the vitality and personal magnetism. In yogic term, this is known as a pranayam. Okay, so these are the different mudras during the pranayam. So it is nothing but the controlled breathing system, and which improves the vitality. Okay, now one practice, it is called as a varman. Now it is also one of the area of the practice in the siddha system of the medicine that is concerned, and it is called as a varman. Okay, I will explain you what is the varman. The varman are the points of intersection of the bone, muscle, tendons, nerves, and the blood vessels. Okay, so the varmans are the points. Okay, लक्षात घ्या, the varman, actually this is the South Indian language, so the names are not relevant to us. ठीक है, normally the Marathi, the varmans are the points of intersection of bones, muscle, tendons, nerves, and the blood vessel. Okay. So these are the points of intersection of the bones. Okay. Points असतात muscle, tendons, nerves, and blood vessel. These are the points of intersection. The ancient Siddhas believe that the disease emerged when these points were adversely affected by an external force. ठीक आहे, आणि डिसीज कधी होतो, when these points were adversely affected by an external force. Okay, so these are called as a diseases. Okay, so varman is what points of intersection of bones, muscle, etc. आणि त्यांच्या म्हणण्यानुसार disease emerged when these points were adversely affected by an external force, and manipulative technique used in the medicine to restore health at the varman is known as a इलाकू मुरई. ठीक आहे, म्हणजे to maintain or restore the health at the varman is known as a ilaku murai. Okay, ilaku murai, and there are believed to be 108 varman according to the siddha tradition. Okay, so you can see this is the varman procedures. So the point of intersections, those are using for the treatment. So any disorder causing these, so in this system those are using these points. Okay, for the treatment. Okay, so here you can see the different points are used. So this process is called as a varman process. Okay, now let us discuss the diagnosis. So the diagnosis of disease involve identifying its causes. Physician generally identifies physician generally identifies of a causative factor through exam of nadi, dhwani, twaka, deham, malam, mutram, etc. Okay, so the pulse, speech, voice, tongue, body, feces, urine, etc. It is generally tested for the identification. And the last part, that is a herbal and mineral treatment. So the extensive research on plants was done by the siddhas, and they also describe the poisonous nature of the some plant and the antidotes for them, and classified plants based on the way they affected the body. Okay, म्हणजे they have studied extensively on the herbal preparation. They describe their poisonous nature also, and they found the antidotes for them, and they have recorded, or they have made written notes about that, and classified plants based on the way they affected the body. Then, for simple ailments, the Siddha practitioner advises the initial use of the herbs. If this does not prove effective, the judicious use of the plants, minerals, and animal product is also advised. Okay. So, if the herbs are not able to cure a disease, then the use of plants, minerals, and animal product is also advised in this system. Then, according to the Siddha theory, preparation made with mercury alone were believed to invest the body with immunity from decay, enabling it to conquer disease. Okay. Then, mercury and sulfur were considered to be supreme curatives in this system, and those minerals, however, are extremely toxic to the human body. Okay, so we are well aware about the mercury and sulfur, but these are considered to be supreme curative in this system. And the siddha medicine is useful for the management of chronic diseases also, and degenerative conditions such as rheumatoid arthritis, autoimmune conditions, collagen disorders, conditions of the central nervous system, and its effectiveness in those situations may vary. Okay, and the last part, that is the dosage form. So like Ayurvedic system, it is our Indian system. So siddha system is also Indian system, we can say. Its origin is there in the Mohenjo-daro, Harappa. So it is also have a dosage form like the solid, liquid, and semi-solid preparation. So like the kashyam, churnam, lihams, telams, guligai, chendram, bhasmam, ghritam, etc. These are the some dosage forms. The names in English are given in the bracket, like the extract, powders, confection, medicated oils, pills, calcs, etc., or tinir, distilled water, etc. Okay, because it is a South Indian, and the Dravidian languages are there, it is very difficult to pronounce it. Okay, normally their language, it is not easy to understand their language. So again, these are the dosage form. So their pronunciation is very difficult. Okay, so all these dosage forms are used in the Siddha system of the medicine. So here we will conclude our today's session. So if you have any doubt, just ask me now. I will unmute yourself.